My name is Dr. Prabha Chandra. I'm a psychiatrist and I work in perinatal mental health. And with me today is consultant obstetrician Dr. Latha Venkatram, and we are going to talk a little bit about the relevance of mental health and mental well-being in women's lives when they are pregnant and in the postpartum period. Dr. Latha, it's wonderful to have you here.
The same here. Yeah.
And as I just mentioned, I think the key thing that we want to discuss with you are about something about how women's mental health is important during the pregnancy as well as in the postpartum period. Not just in terms of having depression or anxiety, but also the mental well-being of a mother. So I'd like to ask you, as an obstetrician, what do you think is the relevance of mental health in a pregnant woman's life?
Is very important not only for herself but to the growing fetus, and also after the baby is born, when it grows up as an individual. It is very important that the maternal mental health is maintained. If you have to have a mentally healthy baby when it is growing within the womb and also when it grows as an individual. And many times mental health issues are not recognized, not addressed. I would say women don't report about their mental health issues easily, and the obstetricians also don't recognize mental health problems easily because of their busy clinics and also lack of awareness, so many factors. So it does take a toll on not only on the lady but also on the fetus. Low birth weight, prematurity is one of our important outcomes, I would say, during pregnancy, if the mother is under a lot of stress or if she has other psychological or psychiatric problems. Low birth weight, not only that the baby doesn't grow properly when it's in the womb, but it has long-term implications. Like you rightly said, it can become diabetic, hypertensive, and also have cardiac problems earlier in life as an individual. Okay. And also the mental health aspects, that is attention deficit, hyperactive disorders, depression, behavioral problems, schizophrenia, all these are increased. Yes,
So
absolutely.
I think if
Yes,
there is
yeah.
one place where we need to put our attention and our focus and our money into, I think it would be the mental health of mothers in pregnancy and in the early postpartum period.
Very much, very much.
So as an obstetrician, what are the kind of issues that mothers come with? What are the kind of mental health issues that present to you?
Many times they don't recognize that they have a mental health issue. That's the biggest problem. So the obstetrician should get herself trained or himself trained to recognize mental health issues. And also bring in patient awareness. Okay, as a part of health education, we should impart knowledge when they have to report, what they have to report, and which is not a normal phenomena for pregnancy. Pregnancy actually is a very normal thing for every woman. I would say every woman is designed to get pregnant and most of the time deliver normally. But it has become quite stressful of late and perceived as stressful, I would say. So the attitude towards pregnancy is very important, a healthy attitude towards pregnancy. They don't have to unnecessarily worry. There is a lot of information available for women, but not every information is the right information. So I think it's important that they get right information and they discuss with the doctor so that they relieve their stresses. Yeah, absolutely. The other thing is multitasking. They want to be achievers. At least during pregnancy, I think they have to de-stress themselves and change their lifestyle a bit. Nuclear families has added on to the stress, and also non-availability of mental health practitioners
As
or
part of
professionals
obstetric
as
setting also.
part of obstetric setting. That's one of the biggest challenges. I'm very glad that we are having this conversation today, because I think it's high time that mental health care professionals and also obstetricians came together and even started combined clinics. That would help a lot of women. So that's what I would say.
Can you sort of give some tips to women who are pregnant or family members about how we can enhance the well-being of mothers in pregnancy? I mean, we know that they worry a lot. We know there's a lot of information available, and sometimes the focus becomes more on the negative rather than the positive.
That's right.
What do you tell the mothers who come to you for obstetric care? What kind of what should they do to feel better?
I think a lot of reassurance from a doctor and also from the family members, that's mother and mother-in-law, etc. That pregnancy is something natural for every woman, and most of the time they don't have complications, they wouldn't have complications during pregnancy. That has to come from both the healthcare professionals as well as the family members. De-stressing is very, very important. As I said, lifestyle change,
cut down extra activities that you're doing at that time.
Yeah, probably.
Not like pack in too much.
Pack in too much, and also not become very target orientated. De-stressing in the form of pursuing hobbies, that would be really good. And also there is a lot of creativity during pregnancy. As a mother, okay, I think they should enjoy the pregnancy. Also doing yoga, it has a profound effect. There have been very important studies that we have also contributed towards yoga and pregnancy, and it not only de-stresses, but all the pregnancy complications are much lower. Also the chances of normal delivery and also problems during labor, all these come down if one can be less stressed.
So good physical outcome and good mental health outcome.
Absolutely. Yeah.
What do you think that husbands can do?
Husbands,
because
I think
they often are in the periphery. They don't really know what's going on. They attribute everything to hormones. And so what is it that a husband, how can he feel useful in terms of enhancing the mental health of his wife at that point?
Being supportive, understanding, and also understanding that there could be mood fluctuations during pregnancy, and also reporting any serious concerns that he has about her mental or physical health. I think that is important. Being supportive throughout pregnancy and also through the labor would go a long way. Of course, postpartum also, they would need some support. Women would need some support. And postpartum problems can be quite special, quite challenging, because you have to cope with the small baby, the new addition, and also
exhaustion and everything.
There can be other social issues in the family.
A lot during the postpartum period.
Absolutely. Also a lot of restrictions on diet and also sleeplessness. All these add on to the problems.
So a husband or a family member can actually be quite supportive at that time. We often tell husbands to take on some of the care.
Absolutely.
And sort of not be just a working dad. But if he has to forego a couple of hours of sleep at night, that's okay, because that enhances the mother's mental health.
True.
Wanted to also ask you, but some women have pre-existing problems with mental health problems. It may be serious problems, or it may have been a postpartum depression in the previous episode, anxiety, personality issues. How can an obstetrician encourage women to talk about it, and what all should women tell? Because women often do not report some of these things to the obstetrician because they think they've come for the pregnancy. So why is it important to talk about your previous mental health issues? So what's your advice to women?
I think it's very important for women with pre-existing mental health conditions to see the mental health care professionals. Also, if they're under a lot of stress, I think it is better to get themselves assessed by a counselor. There are lots of taboos about seeing a mental health
professional.
Professionals. I think that should go, because we are risking our progeny.
Yes.
I think it's very important to give the best.
That's right.
Yeah.
In fact, a lot of mothers, like you mentioned, may stop medication during pregnancy abruptly,
That's right.
because they worry about the impact of the medication on pregnancy. And I think mothers need to know that, untreated depression and untreated anxiety may be even more harmful than medications.
Yes.
And the fact that, there are safe medications available, relatively safer medications available.
And also you will be putting them on the lowest dose possible.
Exactly.
Yeah. And also whatever is safest for the pregnancy amongst the medications available.
That's right, yeah.
So I don't think they should fear taking the
Correct,
medications.
yeah.
That's very important.
And also discuss it very openly with the obstetrician about what is going on
Absolutely.
and their apprehensions, their fears, because if the condition is not very severe, then we can actually go without medication and focus on psychotherapy or other forms of counseling.
Yeah,
but sometimes just because they fear that you might put them on medication, they don't reveal their problems.
That's right.
Also a little bit about the postpartum period, a fairly vulnerable period. In fact, it has been known that it's for mental health problems, it's probably the highest risk in a woman's life is the postpartum period.
That's right.
And given that and the huge cultural issues in India, many of them related to rituals, related to gender.
Absolutely. If they had a female child and if they were expecting a male child, I think that is one of the biggest causes for depression in a woman.
Yes.
As far as I have seen.
In fact, some simple things like saying that the child is not very fair or the child is too thin.
Yes.
Sometimes in a vulnerable woman, comments like this can also trigger off a huge reaction, and we have seen mothers feeling quite low and becoming depressed, thinking that they have in some way displeased the family or not met the expectations of the family. So what do you think is the family's role? Because often the mothers are with either their in-laws or with their parents. What do you think is the role of a family member during the postpartum period?
Yeah, again, very important. It's very important to provide proper nutrition. There are lots of taboos about postpartum diet. And the restrict water, the restrict, nutritious food.
Going out.
Yeah, so going out, etc. So that also adds on to the mental health problems. The other thing is, how to support this woman. In turn, she would be supporting the baby. Breastfeeding gets affected. I'm sure you would agree with me.
In fact, we
bonding,
have
breastfeeding, all these get affected if the lady is under a lot of stress or has
depression
other,
or anxiety,
mental health issues. So families should support the woman, and also all these small little things, I think,
like the rituals and all, should let go a little.
Let go a little. Whatever is meaningful, okay, but
to overdo it.
Yes. They should not be putting the woman through stress. It should be enjoyable. Whatever is acceptable to the woman, whatever is enjoyable should be encouraged. And of course, the husband's role is very big. I know he is usually stuck between the
in-laws
and the wife. But I think it is important for him to cope properly during this period.
In fact, a lot of family members, if a woman has a mental health problem, they might feel having a baby will cure it all. Will make a difference. Once she's a mother, it'll be okay. But I think preparation for motherhood, in any woman is important. That you have to. It's not like a given. It doesn't happen suddenly. You can't become a mother just like that. In fact, I have mothers who often feel a little apprehensive because they say, I'm not bonding with the baby the way I ought to. It's like I can't feel the way I should. And sometimes just normalizing it, that it's okay not to feel this great love towards the baby because you're tired, you're exhausted, baby is small, difficult to manage, sometimes cranky. So it's okay not to feel like some, super mom, and to let feelings develop as they go on.
The expectations of the woman and the family can be quite high. And I think you have to come to reality, and also the doctor should promote the well-being by reassuring them.
In fact, a lot of family members, with mothers with depression or anxiety or even minor mental health problems would say, you ought to be so happy, you have such a lovely baby, why are you feeling sad, why are you crying? And I think, more than that, I think the family members need to be alert that this is a vulnerable period. Look out for signs that she might be having a relapse if she has a previous problem, or if she's a little more tearful or a little more distant from the baby, can't sleep very well, to be alert.
Looking after herself and things like that. I think those things should be reported to the obstetricians
Or the pediatrician.
Okay, because they would be seeing us more often.
Exactly. Yes.
And we should be aware of these symptoms and refer them on to you. And also in a busy postnatal or antenatal clinic, we might not be able to give her solace and do justice for the complaints that they come up with. So I think it's important that we have a specialized perinatal clinic, perinatal
Mental health service,
service. I think the time has come.
For that. Yeah. Thank you, Dr. Latha. Thank you for all these comments. What we learned, to summarize, is that pregnancy is a very important phase of a woman's life, and so is the postpartum period, not only for the woman, but also for the developing fetus and when the baby grows into an adult. These are critical periods where a lot can be done to improve the well-being of mums and babies. And we hope that both obstetricians and mental health professionals and mothers and families will continue to support the mother and improve her mental well-being during this phase.